Welcome to CityLife. I'm Beverly Thompson. As the number of positive cases of COVID-19 continues to increase in Durham County, the Durham Recovery and Renewal Task Force is focusing much of its attention on the Latinx community. Joining me to talk about why that's the case and what's being done to protect this vulnerable community are Durham County Health Director Rod Jenkins and Pilar Rocha-Goldberg, the President and CEO of Centro, Hispano. Welcome and thank you both for joining me.
Thank you.
Thank you for having me.
So, Rod, let's look at the COVID-19 cases overall in Durham. We know that the number of cases is going up, and that's not good. But what do those numbers really tell us about the spread of this virus in Durham?
Well, again, Beverly, I thank you for having me. And the numbers say a lot, but there are glimmers of hope within the numbers. It's no secret that we have a significant increase in cases, which is largely due to the result of expanded testing. Testing is important because it certainly lets us know and how to locate those areas where prevalence is really high. But it also reminds us that this pandemic is far from over. So it's also no secret that we're seeing a significant spike among our Latinx community and employees who work in trades such as construction and janitorial services, and a lot of their loved ones are most certainly being affected. But then we're also seeing a significant number of cases come in the East Durham area, particularly two zip codes, 27704 and 27703. So again, whereas within the past, I say within March and April, our community spread was most certainly low because a lot of our cases were attributed to travelers and healthcare workers. So our community spread percentage was right at about 14%. But within the past 2 months, i.e. May and June, they have increased to 33% and 30% respectively. So that's a cause of concern. So again, we do know that testing is being promoted, but again, with testing comes a lot of spikes in our numbers.
Okay. Pilar, you are a member of the Durham Recovery and Renewal Task Force. Please remind us what that task force is all about.
Yeah, thank you. So the task force is really a group of people that represent business leaders, faith and community leaders, public health experts, and also the county's Emergency Operations Center. And the group, the idea is to advise the mayor and the county commissioner, Wendy Jacobs, how to reopen in a safety way, but also in a very successfully way, and following some of the recommendations we give as a task force.
Very important role. I think it's great that the mayor and county commissioner are listening to the community and that you represent a very important part of the community as well. So Rod, you mentioned that our Hispanic or Latinx residents are among the most vulnerable. I know that the numbers are changing every day, but generally, what are they showing us about how this community is being impacted?
Great question. This vibrant and most important sector of our community is heavily impacted. And it's important to remember to the listening audience, while the majority of us were able to hunker down and be safe in place or safer in place, this community continued to keep the economy running. And to that, we owe a debt of gratitude. But most of our cases at present, as aforementioned, is within the Hispanic or Latinx community. And again, that means that for this community to only represent 13.7% of all Durham County residents, as of the month of June, they are representing 77% of all of our cases. So that's dire. So to be exact, it was around April 27th when we began to see a significant increase inside the numbers. And then we convened great people like Pilar and El Centro, Hispano, and a number of different healthcare experts from our healthcare coalition. and we presented them with the data because in Durham County, all of our public health efforts are data driven. And then it's been a call to action ever since, Beverly.
Mm-hmm. Are there certain sectors or industry that is more prevalent than others, Rod?
It is. We are seeing significant increases in cases and transmission within the construction industry. We're also seeing, which is, as you would guess, is predominantly male and comprises about 91% male and probably 83% of our cases. Janitorial services, which kind of represents a little mix, but is predominantly female. Also is an industry that represents a huge swath of our transmission, and it's right at about 81%. So these, these industries are really being held by our Hispanic and Latinx community, and thus the infections are really being seen in these industries.
Mm-hmm. So Pilar, what is it about the construction industry or the work setting even that seems to be such a challenge for employers and Hispanic or Latinx individuals when it comes to this virus?
Yes, one of the things that Rod mentioned is not everybody has the luxury to work from home, and these workers have to be every day outside working, but also they need to work. They don't want to miss one day of work because it's missing one day of paid, and they need to put food on the tables on their families and also take care of rent and utilities and other expenses. So they need to go to work. They have fear of letting the employers that they are sick because the majority don't have sick time. So again, if they get sick or they feel sick, they rather don't tell because then they don't get paid. The other thing we are seeing is a lot of them have to ride together to go to work. So that means they can't follow, that the distancing we are telling everybody to do. So I think those are, and also working in that field using masks probably is not as easy as when you're working in other fields. So that makes one of the second W's we tell people, yes, wearing the mask. So we think those are the factors that are affecting the community.
Rod, are there any other reasons why the Latinx community has been hit so hard by this COVID-19?
I do believe Pilar touched on a good many of them, but again, we're certainly seeing the result of ride sharing, multi-generational living. You have huge swaths, different generations living together, and to be honest, also some folks who may not be family members are also living inside houses and dwellings with many individuals. Pilar touched on the inability to take off of work and fear of losing their jobs. That's something that we've been hearing a lot about from our contact tracing team. But most importantly, it's mainly the togetherness that is expressed by this community. They love being with one another. They have an affinity for family, and to mandate or even strongly suggest that they not do this is something that this community is not necessarily used to or accustomed to. But unfortunately, Beverly, that's the rules of engagement when it comes to COVID.
Pilar, what have you seen firsthand or heard about through your work as far as the challenges facing the Latinx community with COVID-19?
Yes, thank you. So again, I think one of the main pieces is the payment, not having the money if they don't work. But also the thing I will say is, again, have in mind that all these health disparities existed before COVID and now are exacerbated because COVID. But also, I know we've been trying to have really good information for them to get in a timely and culturally manner appropriate, so they can get all the information about testing, about how to take care of themselves, but also, and I know the health department have been doing a great work as Lincoln to help the community with testing, but still a lot of lack of really knowledge how to get tested. And then I know the communication, and it has been hard for the health department to do the tracer, calling people and not having people responding to that. So that's also another of the things I think is affecting our community. And the other thing is when somebody gets sick, it's really difficult to get isolated because as Rod was saying, they live with family or a lot of people in the same house, and it's difficult to have one person isolated. So I think also that's not helping with the spreading of the virus.
Mm-hmm. So Pilar, I know that the task force is hosting roundtable discussions with various stakeholder groups that have been impacted by COVID-19. In general, who has been a part of these discussions surrounding the Latinx impact?
Yes, so we've been trying to really have representation in all the different roundtables because our community, is represented in all these sectors. But also we started an immigrant and refugee roundtable to bring people from, Latinx background or working with the Latinx community and the refugees, so we can have more ideas what is happening with the community and how we can help the community, but also to see if some of these participants could represent or come to these other roundtables, because there are many, to bring the voice of the community and also bring back to the community what is talk in those roundtables.
So what has been the outcome of some of those discussions that you've had, especially in addressing some of the reasons that we've mentioned here, insofar as why the Latinx community is being hit so hard?
Yes, so we've been talking about, in almost every sector, we talk about the same issues we talked before, the barriers I mentioned before. But what has come up with some of the roundtables, and mainly the immigrant refugee roundtable, is really giving recommendations how we can, as a community and also as local government, city and county, can support and change some of the factors we were talking before. Yes, how we can push for more testing and tracers so that people can get to that. The information, again, the way we are getting the information, and even doing some more in-person outreach so we can really get to the community, not relying only on social media or radio or TV, but also seeing how we can work with employers to help, to push the employees, the workers, to get tested if they feel sick, but also supporting them, paying that day, or if they are sick, how we can get support with payment. So that we think will lower the cases.
I certainly hope that works. All of us were heartbroken when we heard about the little girl who passed away, Uyoshi. It just broke our hearts. So we have to, try to do whatever we can to tell everybody how important wearing a face mask is. So, Rod, what can people do? And I think I probably just mentioned something, who are part of the Latinx community, for that matter, to just help stop or slow the spread of COVID-19?
We keep continuing to tell folks that absent of a vaccine, the most easiest and effective way to slow the spread is simply to stay at home. That is the clear-cut answer. However, if you have to go out and leave home, we ask that you wear your face covering properly, not sagging under your chin, not on the side of your ears, but we want you to wear it properly to where it's over your nose and over your mouth in order to reduce the transmission of any droplets that you may have. We're proud. I think I've been saying it for several weeks now, but Durham has led the way, and Durham, since March the 28th, has put inside their local orders that face coverings are required. And now it seems as if not only the state but the world is really catching up to what Durham has been doing. And under the leadership of Chairman Chairwoman Wendy Jacobs, who was very, very adamant and a strong advocate for face coverings. She most certainly wanted it to be in there, and it's an evidence-based, scientific proof of them being able to also want to make sure that we're able to use it effectively. So we're elated that she had that visionary approach to doing it. I think the other thing I can say is to the members of our Latinx community, we certainly want you to understand that we are compassionate to your needs. Public health is here. So from a contact tracing and investigation perspective, we just need and humbly request cooperation. When they call, they're not on a hunting or fishing expedition. They're really calling to really alert you and really find information that's going to help us to mitigate the spread of COVID. We just need that information. And this is nothing new. This is something, contact tracing is something that's really indigenous to public health. This is what we do. We've been doing this for centuries. And that cooperation will help us to really reduce the spread of COVID.
So it's a matter of trust, right?
Yes, ma'am.
We're going to do the right thing. Pilar, what kind of outreach is being done in the Hispanic community to make sure that people get what they need in the way of protective equipment and information?
Yeah, definitely. So we've been trying to collaborate with the different agencies. We share always what the health department put out there for our community. And also we create other things and communications to help with the community. We just launched a communication campaign with the Spanish media. So we give a unified message to the community. But also we've been helping distributing food so people can have food on the table, but also when people are sick and they have COVID and they have to stay home, we make sure with other partners to deliver food to people so they don't have to go out. But also with the face masks or face covering, we've been collaborating with the Community Health Coalition that is at the same time collaborating with Cover Durham. So Cover Durham is giving free masks to the community members, and we've been distributing some of those, and also we've been distributing to Latino businesses and making sure they have it so they can really also ask their customers to wear it if they really have the masks. And also from our side, from El Centro, we bought some masks from 15 Latinx artisans. And we are distributing these masks when we distribute food. We give them a package of masks for adults and for children. And the masks also, I think it's important not only to give the masks away, but also to give the instructions how to wear them and how to take care of the masks if they, or dispose of the masks if they are the surgical masks, or how to take off the others and wash them so they really are protected all the time. So those are the efforts we've been doing.
Great information. So Rod, I know people wonder, should I be tested? I have a little cough. I have a fever, or I'm just achy. Is it allergies? Is it something else? People wonder, who should get tested, or when should people get tested for COVID?
Excellent question. And as it stands right now, with so much emphasis on testing, again, we still rely on CDC and DHHS guidance, Beverly. So I would say and submit to our residents, if you're experiencing symptoms, or if you're at high risk for exposure, to include those individuals who are in what we consider to be historically marginalized populations. If you're an essential worker, or if you've just had close contact with someone who you know for a fact has tested positive, you should get tested. State guidelines have also indicated, Beverly, that if you have attended a protest or a rally or a mass gathering, exercise your ability to make your voice heard. You should also get tested. And it's so easy now to find a site near you. We've worked hard on Durham County Department of Public Health's Data Hub, which should be your reliable and first source of accurate information on all things COVID. That website is decopublichealth.org/COVID testing. It provides a comprehensive list of all testing sites in Durham. I'd also like to mention that the state, on the state website, DHH's website, there's a tool called Find My Testing Place, which works pretty much the same way. You can go to that site, input your address, and it will let you know all the testing sites closest to you. So these test finders are available because testing has been expanded so far and wide, and we have greater capacity to test now, not like in the days in early March when testing was only relegated to those people who were like first responders and on the front lines. So we encourage you to utilize those ways to get tested.
Okay. Pilar, do you know if all the testing sites are set up to handle Spanish-speaking clients?
Thank you. That's a good question. I know for sure at Lincoln, they are ready to do it, and also in the Duke clinics. What we found is it's difficult. People can go to the websites and pull the information, but that's itself a barrier for our community. And also for other sites, they need to fill out the forms online. So it's not that clear. And for some of them, it's not clear if they need to have an ID to show to be able to get tested. So I think the most reliable is Lincoln and Duke for the testing, but we are also pushing for other testing sites that they feel more comfortable. And one of the education pieces or information piece we are creating is specifically which phone numbers they need to call directly to get tested. So it's not that cumbersome for them to find the testing place and get to the testing.
Okay, good information. So we've come to almost the end of our show. Is there anything else either of you would like to add about this highly important topic for everybody, not just the Hispanic Latinx community, but we all need to know how we can help each other in this time?
Yeah, so I would say, again, look for help and find information. We are at El Centro, we are here, we are with our 2 phone lines open all day, every day. So you can call us for any information you need or for any help. And if we don't have it, if we can't provide it directly, we have a lot of partners and stakeholders that can help. So please don't be with yourself or your circle of family or friends, because I know also for some of our community members, if they get positive, they feel like they don't want to tell anybody because then people discriminate them for that. And I know it is important, and we've been talking about giving the information of, because it's very, very bothersome that the disproportion of Latinx community with the virus. But also some people feel like, again, it's another thing to discriminate us. But unfortunately, we need to be aware of it and don't feel that way. The way is to feel how we can help you, and there are people to help you. And I know it's in general for every community member.
Pilar, can you give us that phone number one more time?
Yeah, so they can call to 919-687-46, or they can call to 919-941-0132.
Okay. And Rod, is there anything else you would like to add to wrap us up?
I would just say, as your public health director, I just encourage you all to not let up. There's this thing that they call COVID fatigue, and now is not the time to be fatigued. We look around the United States and we are seeing states begin to revert back and to realize that they've made errors, Beverly, in opening up too early. And I couldn't be more proud of our Durham elected officials, but also our state governor, Governor Cooper, who really took a very unpopular stance on all of his orders, but more importantly, took a more unpopular stance on extending our phase 2 safer at home order. And we really need to support Governor Cooper because he is really one of the rare governors that's really listening to the scientific experts and the public health experts and really doing what's right to reduce transmissions in the state of North Carolina. And their benchmarks are really helping us to really stay safer. But as I mentioned, this is not the time to be fatigued. It's the time to stay the course, to practice that act of kindness. I say again, an act of kindness and wearing your face covering. You're extending your courtesy to your population, to your family members, to your loved ones by wearing that face covering. Also, just to know that Durham Public Health continues to work tirelessly with great partners like Pilar and Centro Hispano, and also the other Latin 19 members who are tirelessly working to come up with ways to reduce transmission inside our Hispanic community. But we thank you for platforms like this to allow us to promote awareness of all things Durham.
All right. Thank you both for joining me. I really appreciate it. This is just such an important topic, and I know how busy you both are. And thank you so much for joining me.
Thank you for inviting us.
Thank you. Thank you for joining us for City Life. And don't forget to follow us on social media. Watch us on Durham Television Network and on YouTube. And you can listen to our podcast on iTunes as well. I'm Beverly Thompson. Thank you for joining me to learn more about City Life in Durham.